I'd like to introduce Margaret from the United States, who takes LDN. Thank you for joining me, Margaret.
Hi. Nice
Could
to
you,
meet you.
thank you. Could you tell us when you first started to get sick? How old were you?
Well, after the birth of my first child, when I was 20, I started to have a lot of hormonal problems and symptoms, and after several years and several doctors, my first diagnosis was with polycystic ovarian syndrome, and I suffered through many years of trying to find someone to treat me in a way that didn't have a lot of side effects, and I eventually went on metformin, and that was very helpful. And I kind of had a period of good health for several years, and then when I was about 35, I started to have a lot of new symptoms that were similar but different and more intense, and after probably 4 years of that, I finally was diagnosed with having Cushing's disease and having an ACTH-secreting pituitary tumor. And I had pituitary surgery 2 years ago in May of 2013, and they found the tumor, they got it out, and I went into remission. And the recovery from that is quite brutal. You have to slowly wean off of steroids. You have to take them as replacement because your pituitary doesn't work right for a while. And the withdrawal from steroids has been likened to heroin withdrawal.
Oh,
So it's very intense. It's very painful. You have a lot of joint pain, muscle pain, a lot of psychological symptoms, depression, anxiety, because not having enough cortisol is almost as anxious-provoking as having too much. And so it's, a good year of weaning. And then what happens is because you had high cortisol for so long, a lot of autoimmune things pop up that were being suppressed by the cortisol. And that's kind of where I'm at this point, where now I have really high Hashimoto's titers, and I'd have to replace a lot of hormones, and I'm still in the recovery process from Cushing's. But, in the meantime, 10 other autoimmune things get you.
Mm.
So
before you started on LDN, could you describe what a typical day for you felt like?
Well, I started on LDN when I was about 16 months post-op from pituitary surgery. So I would say that I had very little quality of life. I was still in the place where I was in a lot of pain. I didn't work full-time. I was only working part-time and only from home at that point. I could barely do the grocery store by myself and come back home. I still have people taking my kids to school for me and basically helping me just to survive.
Mm-hmm.
So I would say probably on a scale of 1 to 10, it was about a 3.
Oh, wow.
Yeah.
As good as that.
Yeah, not a good life.
No.
Well, I mean, it was better than when I had Cushing's, where my life was a 0.
Mm-hmm.
Before they took the tumor out, I was homebound and could not work, didn't think straight, had severe panic disorder and anxiety all the time, and hadn't slept in probably 2 years by the time I had surgery.
Oh.
Yeah.
Mm.
So it's a really intense disease.
It certainly sounds like it. So how did you hear about LDN?
My endocrinologist, he is a Cushing's specialist, that's what he specializes in, he actually recommends it to a lot of his post-op patients because most of us have these underlying autoimmune problems. And he gives it out quite frequently, especially if you kind of linger in your recovery. I mean, some people just snap right back. That wasn't me. Maybe because I was older, I'm not sure. But he recommended it, and my primary care doctor prescribed it for me. I ended up making my own with 50 milliliters and 50 milligram pills because my insurance doesn't cover compounding, and that was the most economical way for me to do it. And so my primary care doctor, he's in on it too, and he actually prescribes it for me and, does all the follow-up for it for me.
Mm-hmm. And when you started, did you notice any side effects at all?
Well, I started on 0.5, because I was doing liquid, it was really easy to, change my dose based on whatever I was noticing. So the very first thing that I noticed was that I started dreaming, like a lot. And they weren't bad dreams. They were actually amazing, wonderful dreams. But when you have Cushing's and you don't sleep for a long time, you don't dream anymore because you never get to REM sleep. And I'd had several sleep studies, when I was sick but didn't know what was wrong with me, and I never had any REM at all. So I will say that the very first thing that happened was it gave me back REM sleep. And I started dreaming on a regular basis. And each increase in dose, I would have several days of just fantastical dreams, which is a good thing to me. So it's a side effect, but a good one to me, because they were never bad dreams or nightmares or anything like that. I did notice that on each dose increase that I would have a little bit of bowel motility, very short-lived. And when you have hormone issues, that's not unusual. There's a lot of stuff going on in my body. So I don't know if I can particularly attribute it to LDN, but I think so. So, and it just was, ever been getting used to it. So at this point, my endo wants me to work up to 4, but I'm very slowly working my way up. Right now I'm on 4. And that has been a process of about a year of getting up that high. And I stayed at 3 for a long time. But my Hashi titers were still very high, and so he wanted me to go up a little higher and see if we could get it to work.
So what is a typical day like for you now?
Well, I attribute some of it to LDN. Some of it is just simply time and my pituitary recovering. But I now work full-time. I am completely in control of my own life. I still have some chronic pain. It's much better. I do think that the LDN helped with the pain a lot. It is now where I can take 2 Motrin a day and be pretty okay. I also use acupuncture extensively, which is, not about LDN, but that is a huge part of my recovery as well. And I would say, my life is an 8.
Wow.
I work full-time, probably 60 hours a week. I take my own kids to school. I have a child in college now, and I take him to school, and I grocery shop, clothing shop. I do everything now. And so it's a huge improvement from before I had surgery for my pituitary tumor. And, I think LDN is probably half that. I won't be stopping it anytime soon.
What would you say to other people who are thinking of trying LDN?
I think it's such a long-standing drug that's been around for so long, and they know what the side effects are, and it's really so low risk. Why not try it? And I think that's how I presented it to my primary care. I said, because he had other people on it for actual addiction, and so he had heard of it. He was aware of the drug. At such a low dose, he just had no problem letting me try it, even if he didn't really believe in it necessarily. So I would approach it in that way, that, the risks are very low. And if it doesn't help, then just quit. And if it does, then amazing. That's what I would say. Try it.
Well, you have such an amazing story and so inspirational for other people. Thank you very much for sharing it with us.
Oh, you're welcome.